How would you define a health disparity? Stay tuned for Health Watch and we'll give you some answers. Hello, I'm Terrence Hacker Anderson and this is Health Watch. So, how would you define a health disparity? Here are some examples provided by the Centers for Disease Control and Prevention, January 14, 2011, Morbidity and Mortality Weekly Report. When it comes to infant mortality, babies born to African American women are 1.5 to 3 times more likely to die than infants born to women of other races or ethnicities. African American men and women are much more likely to die of heart disease and stroke than whites. The rate of preventable hospitalizations is more than double amongst African Americans than whites. With the exception of Asians and Pacific Islanders, new rates of HIV infection are highest among racial and ethnic minorities. Hypertension is by far most prevalent among non-Hispanic blacks. Also note that uninsured persons are only about half as likely to have their hypertension under control than insured persons. Adolescent pregnancy birth rates for Hispanics and non-Hispanic blacks are some 3 times higher than those of whites. So, why do these disparities exist and what can be done about them? Today on Health Watch, we're going to have that discussion, and we'll tell you about a special event coming up soon that you should certainly make note of. We're also going to be doing something pretty different today. I will be interviewing one of our guests via Skype, a Health Watch first. You don't want to miss that. But first, let me introduce our guest in the studio today. It gives me great pleasure to introduce you to Dr. Karen Rimley, who is making a return visit to Health Watch. A former commissioner of the Virginia Department of Health, Dr. Rimley is the founding director of the M. Foscue Brock Institute for Community and Global Health at the Eastern Virginia Medical School. I'm also delighted to introduce Shatada Floyd White, director of Days for Girls Hampton Roads. Next up is Linda Botts, coordinator, Norfolk Medical Reserve Corps, Norfolk Department of Public Health. And last but certainly not least is James Jones, a career development specialist with the Norfolk Redevelopment and Housing Authority. And now for a special unprecedented nod to technology on Health Watch. My next guest is joining us via Skype. Join me please now in welcoming filmmaker Byron Hurt, writer, producer, director of Soul Food Junkies, a documentary on the impact of the popularly known soul food. Soul Food Junkies is winner of Best Documentary at the 2012 Urban World Film Festival and winner of the CNN Best Documentary Award at the 2012 American Black Film Festival. Welcome to Health Watch, everyone.
Thank you.
Brian, I know that you have a tight schedule and we're Skyping you in today, so I'm going to address my first questions to you, okay? Tell me, how did the movie Soul Food Junkies come into being? How did you get started on that project?
Well, the inspiration from that movie came from my father and my relationship with my father, and my father's relationship with food, soul food in particular. And so my father, for as long as I had known him, was overweight, and I was always concerned about his health as a result from the time that I was a very young boy. And so in 2004, he was diagnosed with a very serious form of cancer. And I started doing research about what could possibly lead to that form of cancer, and food was a big part of it. And there were several types of food that he ate that were in the soul food family. And so I started doing more research and started to see how African Americans topped the list in almost every single statistical category when it came to preventable nutritional illnesses. And so I decided that I would make a film that would potentially get people to start thinking more critically about what we put into our bodies.
So it's pretty apparent then that the so-called soul food diet does have an impact on health disparities as they affect African Americans.
Well, I don't want to completely disparage soul food because there are many soul food dishes that are healthy for you if cooked in a certain way, prepared in a certain way. But there's no question that certain traditional soul food dishes that tend to be somewhat staples in African American families and communities are unhealthy, right? So things like fried chicken, macaroni and cheese, anything that's fried, any vegetable that is overly cooked and cooked with fatty meats and a lot of salt and a lot of seasonings are not very healthy for you. But there are a lot of things that are healthy for you. I mean, greens are extremely healthy for you.
Indeed.
There are certain cuts of meat that are healthy for you if you do prepare them the right way. So there's certain things about some of the traditional foods that are not necessarily good for you and healthy for you. But if we make changes to them and we modify the way we prepare it, it's not so bad. But the problem is that's not what a lot of people are doing. And on top of that, we're eating a lot of processed foods,
Indeed.
fast foods, foods that come out of a box, that are stored and processed and that have a lot of additives that are not healthy for us either. And so when you combine those two, traditional soul food diet, and you combine that with fast food, processed foods, and a sedentary lifestyle, that's a recipe for the disaster in terms of health and wellness. We haven't even talked about like stress,
right,
all sorts of emotional, issues that could have an impact on someone's health.
Well, this is a project that you're obviously very close to for a lot of personal reasons. And you basically have answered a fair amount of the questions that I wanted to ask you. So what I'd like to do now is to get to a clip. I think you know what clip it is we're about to show. And if you could just set it up for us.
Well, I believe this is part of the tease, the trailer for the film, I believe. I'm not sure.
I think it's the one that you had sent us. We found something from ITVS, but I'm pretty sure it's the one that you had sent us.
Yes,
we've done a pretty good description of what the project is and how it impacted you personally. So if you like, let's just go right to the clip.
Yeah, sure.
Okay. All right, guys, if we could roll that clip in.
You haven't had nothing till you have my black eyed peas.
Came for the fried chicken.
It's comfort food. You eat it and it makes you feel better.
Good Lord, good meat. Come on, let's eat. Hallelujah.
Soul food is a repository for our history, and soul food represents Black.
At the best moments of the Black freedom struggle, when you had organizations like the Black Panthers, they understood the relationship between developing a Black nation and having healthy diets.
In the Nation of Islam, we have referred to a soul food diet as a slave diet.
There's so many mythologies that have accreted onto the idea of what Black people were eating during the time of slavery.
So, she'll call it death food because it will kill you.
It's almost like you eat, you get big, you go to college, you get your education, you get your diabetes, you get your high blood pressure, and you die.
The most important thing is that people complicate their understanding of what soul food is, because it's easy to say that it's the bane of African American health. The bigger cause of the decline of African American health is the industrialization of our food system.
In this supermarket in my neighborhood, I see vegetables that look like they're having a nervous breakdown, and they're asking people the regular price for it.
In America, there is a class-based apartheid in the food system. And if you live in low-income communities, there's often very little healthy food.
You want to wipe out an entire generation of people, when you want to engage in the kind of 21st century genocide, all you have to do is continue to do what we're doing, which is deprive people of access to healthy food.
What we're doing is an attempt to turn people into
I run my own farmers market now. Come there, get y'all fresh produce if y'all in Chicago.
It also has to be combined with education.
You cannot really create a culture of advancement if you don't have people who are plugged into the ways that we can promote life.
I have to tell you, watching that clip made me a little hungry. Yeah. So,
a lot of people told me.
Huh?
A lot of people have said that my film is a double-edged sword. It makes them hungry, but it also makes them think, too, about the kind of food that they eat as well.
Well, I'm sure we're going to get a lot of questions about the film, and folks want to get more information about it and where they can find out information. Why don't you give us, please, a website address that folks can go to get more information?
Well, you can go to my website. My website is www.b as in boy, hurt, HURT.com. I'm also on Twitter, and my handle is @ByronHurt, and my Twitter name is @ByronHurt. You can also find me on Facebook as well.
All right. Brother, I want to thank you so very much for joining us today. I see that Northeastern T-shirt there.
That's right.
Yeah.
I was just up in Boston yesterday. I showed my film to over 80 young teens from Roxbury, Massachusetts, which is right next door to Northeastern University. And it was a great event, and I was very proud that my film had the opportunity to reach so many young people of color.
Well, again, thank you so very much for joining us and helping us break ground with this unprecedented foray into technology. Byron, thank you, brother. Nice talking to you. Take care. Dr. Remley, again, you've been on Health Watch before. I want to welcome you back. And as the founding director of the M. Foscue Brock Institute, tell us what it is, the M. Foscue Brock Institute for Community and Global Health. What is your mission? What is that, the mission of the Institute?
It's interesting. It started, Mr. Brock, M. Foscue Brock, was somebody who was in the community, was a physician who cared for people with TB. In a community and throughout his career, and was well known for being someone who cared for anyone who came to him to do anything he could do. And so the Brocks wanted to start this institute to really further the mission of the medical school. The medical school was started in the community for the community, but to really begin to give all of the students who come to the school and the faculty in the community the opportunity to learn together. So how do we start to integrate into all of our educational programs, research programs, and what we do, not just community service, but service learning. So we all listen and learn together.
In your work as a physician and as a healthcare administrator, have you, how have you seen the impact of health disparities?
Well, it's been very interesting because I've been around for a while now. You can tell with my gray hair. And I started practicing.
I can relate to that
there
myself.
You go. I started practicing in the 1970s. And an interesting article that just came out from the CDC looking at cause of death and health disparities from 1970 to 2010. And there was a 10% increase in life expectancy in white people. There was a 17% increase in life expectancy for African American people, but there's still a big gap. So throughout my career, whether I was a bedside clinician or involved in public health, you still see these gaps that don't make sense in terms of disparities of care. You mentioned infant mortality, things that just should not happen, that really are more social justice and human rights issues. And so I'm passionate about narrowing that gap.
Now, on September 28th, we're doing a major event at the North Department of Public Health, Illuminating Generations of Minority Health. And you and McBib Gameda, who's the Vice President of Diversity and Inclusion at ABMS, are going to do a tag team presentation. Why don't you tell us about give us the topic and what you're going to jointly discuss.
We're going to talk about actually food, social determinants of health, where we live, what we do, and how we do that impact our health, and how we can make important decisions, whether it's talking about soul food or whether it's talking about other activities that we can do or ways we can improve our community as a community can make us all be healthier.
Okay. Well, I'm looking forward to that. And guys, any questions that I ask you in the interview, do please feel free to chime in at any point. Shatada, you've emerged as our Illuminating Good Health Coalition angel, being the chief fundraiser for the coalition. And so you've just done exceedingly well for us. And you are the director of Days for Girls Hampton Roads, which is a part of Days for Girls International. Why don't you tell us a little bit about that agency?
Well, Days for Girls International is actually a nonprofit organization that provide quality, sustainable mental health management to girls and young women in third world countries. And what that means is that these young girls in these third world countries, they don't have access to feminine hygiene products. So what they'll do is that they'll use whatever they can find. They'll use mattress stuffings, corn husks, newspapers, even rocks, whatever they can find to be a barrier between their body and their clothing, just to maintain their dignity. Sometimes they'll even stay home from school. Well, these are third world countries, so we do know that poverty is eradicated through education. But if these girls aren't able to go to school, then the cycle continues for them and their families. So what Days for Girls does, actually what Days stand for in Days for Girls, is that we provide reusable feminine hygiene kits to these girls to allow them to go to school and get those days back that they would have missed if they didn't have adequate supplies.
Now, you're going to be wearing many hats, as you did last year for our first event, for the event we have coming up on September 28th. How are you helping to make the Illuminating Generations of Minority Health event take place?
Well, this year I do I'm working on two different aspects. I am doing the fundraising bit again this year, but since we're also adding women and children to our services this year, Linda and I are working on coordinating activities for the children's area. And the CDC did recently come out with a report that stated that there was a decline nationally in childhood obesity. So continue with the First Lady's initiative. We're going to focus our children's area on proper nutrition and physical activity. So we're working with some of the community contributors to be able to bring certain activities to the kids at the event this year.
Now, you have reached out to the same sponsor that funded us last year as our principal sponsor for the event. Can you share who that is? And
Sure.
Okay.
So for the second year in a row, the Walmart Foundation has decided to come aboard as our corporate sponsor. Walmart Foundation is very much in support of the coalition's mission, and so they want to continue to support us so that we can continue to bring our services free to the public.
I see.
So we certainly want to offer a heartfelt thank you to the Walmart 5755 on Tidewater Drive. I'm sorry, it's actually on Little Creek Road in Norfolk.
Okay.
We want
I know
to
exactly
offer
which Walmart
a sincere
you're
thank you
talking
to them and Mr. Hartfeld, and also to the Walmart Foundation for their support this year.
If you could tell us, please, some of the member agencies of the Eliminating Good Health Coalition.
Okay, there's the Norfolk Department of Public Health, Norfolk Community Health Center, Greater Norfolk Medical Society, Centera Norfolk General Cancer Center and Urology of Virginia, American Cancer Society, Hampton Roads Prostate Health Forum, American Diabetes Association, Norfolk Redevelopment and Housing Authority, Hampton University Proton Therapy Institute, Rainbow Hope Health and Wellness Center, Norfolk Medical Reserve Corps, Health Fit Perform Company, the Women's Alliance, myself, ELJ Productions, Eastern Virginia Medical School, and Days for Girls Hampton Roads.
We want to make sure we give all of these supporting agencies their props.
Absolutely.
Linda, you're the coordinator of the Norfolk Medical Reserve Corps. What is the Norfolk Medical Reserve Corps?
The Medical Reserve Corps is actually part of a larger group of volunteers, but essentially here in Norfolk, as throughout Virginia, we are volunteers supporting public health. So we have both medical and non-medical volunteers that come together and support health events both within the public health department and in the community as well.
How will you be supporting the Medical Reserve Corps will be supporting the event on September 28th?
We intend to provide just about every kind of support you can imagine. We'll be the first faces you see at registration.
We couldn't have done it without you last year.
We will provide support for logistics. We have our healthcare professionals coming in to provide some of the screenings and some of those activities. Shatana mentioned that I'm working directly with her in the children's area. We will be handing things out. We'll be directing people. We'll be all over the building that day.
Linda, where do your volunteers tend to come from for the Medical Reserve Corps?
Really from all aspects of the community. We have, as I mentioned, healthcare professionals, and we have a wide range of other skill sets in between. Sometimes people don't realize that public health uses a lot of different skill sets. So even though it says Medical Reserve Corps, it's really open to the entire community. If you have a willingness to serve your community, to give back to your community, there's probably a good role for you within the Medical Reserve Corps.
And what type of screenings are we going to be offering at the event? I know you guys talked about quite a bit. We're doing the prostate cancer and so forth.
We will be doing the prostate cancer, clinical breast exams, oral cancer screening, blood pressure, body mass index, immunizations, Tdap and other types of immunizations, HIV and STD screening, podiatry screenings, and more. We're still scheduling some of those events.
Mr. Jones. The last time I saw you, you came to a meeting and you bought some sliced cantaloupes and some cherry tomatoes. And those things were pretty good. They were grown by kids that are participating in the Community Gardens project that you're running for Norfolk Redevelopment and Housing Authority. Tell us about that project.
Yes, the Young Gardens program is a preventative educational program designed to incorporate interactive learning and social skills development. These young boys, we got them from our different community housing, public housing communities, and we started off with about 20 boys, and they went through classroom theory. Classroom theory involved in social skills to make sure they're gonna work together as a team, learn discipline, communicate with one another, and be able to do the tasks. Far as putting weeds, putting the harvest, and preparing the ground for the different seasons.
And it helps them to eat healthier, too.
As well. Actually, it's like the gardening program has grown to another level. I told them if they really take the time to invest into the program, more people would come. So we getting our senior citizens just getting involved with these boys. We have fourth graders from different elementary schools that's getting involved, because we do have 6 gardening locations. We have 3 community gardens and 3 elementary school gardens, and the kids love it. And I actually started juicing some of the fresh produce from the garden so they can try, and they saying that breaking it down into a liquid form, they able to, their body able to retrieve the nutrients a lot sooner than chewing it.
I like that tactile experience, though.
Yeah.
Chopping down on the veggies.
Yes, and actually Friday we had like I call it a watermelon party, and I had kids in there eating fresh watermelon from the garden, and right after that we had so many cherry tomatoes, and I say, well, who wants to eat cherry tomatoes now? And the kids were like, come on, let's eat them.
Yeah, really.
Yes.
Last year's event, I just want to briefly talk about how the kind of accomplishments that we made last year to engender people to come out this year. What kind of things did we accomplish with last year's event?
Last year we provided a total of 228 free health screenings. People attended from Norfolk, Portsmouth, Chesapeake, Virginia Beach, Suffolk, Hampton, Newport News, and as far away as Chester, Clarendon, Richmond, Hyattsville, and Annapolis, Maryland. 83% of the people who came with a pre-existing condition were able to get free screenings from that condition. 100% of the people who responded to the post-event survey indicated that we should stage another event annually. And I guess people was very receptive of the program, and of course the jazz.
Yeah.
That some people was able to miss.
And this year we're going to be joined by Rasha Small and the Renaissance Band, as much as a family affair this time. Dr. Remley, you mentioned earlier social determinants of health.
Mm-hmm.
Can you describe that a little bit more and give us some examples?
Sure. Excuse me, I'm sorry. I got a tickle. I'm going to read through for you the CDC definition, but I think the best way to think about it is your health is not just what's in your body, it's what you put into it, it's what's around you, from the ground to the sky, and it's the history of where you came from. So it really is a very holistic view. The Centers for Disease Control defines social determinants of health as the circumstances in which people are born, grow up, live, work, and age, as well as the systems that are put in place to deal with illness. So the important component there is not only is it that holistic, but it's also the access you may have to health care. So it's everything from the money you make, the social policies that exist, the schools you go to, the communities that you live in, the safety of the job you're in, and then what we normally think of as health, the health care you receive. So it's a much broader view of who we are. Biology, individual behavior, social environment, physical environment, all come into play, and so it provides us a much broader framework to think about what we can do as a community, what we can all do together to improve our health and to improve the health of our family and our friends.
So it would appear that the type of event that we're scheduling on September 28th will help to address some of those very same things.
Yes, I think it's always so important to raise awareness that it's not just your individual fault. I think, a lot of medicine is always who's to blame. And I think what we have to do is say, no one is to blame. What we have to do is think about what choices can we make, what choices can we make for each other, how can we improve our environment, how can we understand the risks we already have so that we can really move forward and make a difference.
Any of you have a quick comment? We don't have a whole lot of time now, but this whole issue of health disparities and how they are disproportionately impacting racial and ethnic minorities. Well, Dr. Remley just responded. Now, any thoughts that you might have on the importance of the event that we're staging on September 28th?
We see a lot of these people when we go out and do community health events, at church fairs and things like that, and I think this is a really exciting initiative. When we're at those smaller events, we're offering a very select amount of services. This event really brings together a much wider array of services to a community that really needs them.
Okay. Well, what I'd like to do, go ahead, James.
I just want to include the fact that we're including families, and which is going to bring more children. You know, when kids really speak out about something that they like, that pushes their parents to, you know, to add on, to do more and do right. I know my mother have. I always talk about being healthy, so she cut back on, you know, frying the chicken and a lot of salt, and she just cut it out because she know I'm not going to eat it. She don't want to eat it, and she's being more healthy as well.
Well, that documentary that Byron produced, Soul Food Junkies, when you see it, you're going to see some food habits that you're just going to be flabbergasted at what you see. I'm so glad that he did that particular project, and I want to thank him for joining us today, as I want to thank all of you. And before we go, I want to make sure I give this information on the event to our viewers. Guys, thank you so very much for joining us today.
Thank you.
The Eliminating Generations of Minority Health event takes place at the Norfolk Public Health Center, 830 Southampton Avenue, in the intersection of Bramlington and Colley Avenues on September 28, 2013 from 9 a.m. until 2 p.m. On-site registration begins at 8 a.m. promptly. If you would like more information on this event, visit the Health Watch page at www.norfolk.gov/healthwatch. Then click on the Illuminating Good Health Coalition icon. You can also call me, of course, at 757-683-8836. Again, that's 757-683-8836. At that same site, you can also access previous editions of Health Watch. If you'd like to send me an email, you can send it to terrence.affer-anderson@vdh.virginia.gov. For the Norfolk Department of Public Health, I'm Terrence Affer Anderson, and this has been Health Watch.